Ocrevus is the most commonly prescribed disease-modifying therapy for multiple sclerosis. And today we're going to review the major side effects, and I'm happy to answer additional questions in the comments below. Let's have some fun. I should start with a brief conflict of interest statement by saying that although I don't have any financial conflict of interest, I am one of the early adopters of a similar drug, rituximab, for multiple sclerosis, which I've used for a long time. Whether that makes me biased for or against Ocrevus, I leave to you. And by the way, I'm Brandon Beaber. I make videos about multiple sclerosis every Wednesday, so please subscribe and ring the bell for notifications. Now, just to explain what Ocrevus is and how it works, it's given as an infusion slowly through the IV. So the dose is usually 300 milligrams given twice 2 weeks apart. So you go into the infusion center, you get the slow drip, and it takes about 6 hours because this drug can cause infusion reactions, so it has to be given very slowly. You come back 2 weeks later to get the same thing, and then after that you just get one dose, albeit at a higher dose, at 600 milligrams every 6 months. Now, some doctors give different doses and do it in their own way. Some doctors will allow the B cells that are depleted by this medication to come back to reduce the risk of infections. And some people would give the entire 600 milligrams at once, for instance. It can be done. And this drug is approved both for relapsing forms of MS, but because of the success of the Oratorio trial in primary progressive MS, it is also indicated by the FDA for this condition. And it has a half-life of about 26 days, but the effect of the drug is very prolonged because even after the drug is out of the body, it still has a prolonged effect because the B cell counts are very low. Now, the way the drug works is it itself is an antibody that binds to a protein on the surface of B cells called CD20. B cells are the white blood cells that make antibodies, which are proteins which are usually supposed to fight viruses and bacteria. But it turns out that B cells can create autoreactive antibodies and can present autoreactive antigens to other aspects of the immune system. So it's known that B cells are involved in inflammation in multiple sclerosis. This was historically a surprise to neurologists because when we actually look at the lesions in biopsy or autopsy, they don't really contain a lot of B cells. They contain mostly T cells and neutrophils and macrophages. So we thought that MS was more of a T cell mediated disease, but it turns out that the B cells are very important in initiating the inflammation. And there are other drugs that are very similar to Ocrevus, such as Rituxan and ofatumumab. Now, what are the major side effects? Well, there are infusion reactions, which are very common, which are side effects like rash and hives and wheezing and rarely even anaphylaxis when you first get the medication. There are different types of infections. Most people don't have serious infections with this drug, but there are infections you have to be concerned about. Certain indolent viral infections, such as hepatitis B and C, can actually reactivate and cause liver failure with Rituxan. And so you have to be tested for these viruses and potentially get clearance from a hepatology if you actually have hepatitis B or C. Obviously, the drug itself does not cause hepatitis B or C. There's a potential link to cancer, particularly breast cancer, with this drug, although it's unclear. And then some people, whether or not they have an infusion reaction initially, they can actually get very subtle symptoms like a vague ill feeling or rash or fevers for even weeks or rarely months afterwards, which is described as serum sickness due to an abnormal antibody reaction to the drug itself. Now, the infusion reaction isn't necessarily caused by an allergy. Sometimes what happens is because the drug is breaking open the B lymphocytes, their contents sort of spill out in the bloodstreams, and a lot of cytokines and other immune signaling chemicals are released, and that can cause this immune reaction. So you can get rash, hives, wheezing. Usually you would not get anaphylaxis or a severe reaction. And unlike other types of allergic reactions, it doesn't necessarily mean that you can't get the medication. So usually we give medications such as Tylenol, Benadryl, and steroids before the infusion to try to prevent the reactions. And if a reaction occurs, usually we would just stop the infusion, give something such as steroids, and then restart the infusion at a slightly lower rate and see if it can be completed. And often the infusion reactions are the worst with the very first infusion, and they may actually be better with subsequent infusions. So again, it's not the kind of thing where you can't get the medication just because you have an infusion reaction. Now, infections usually aren't that severe, but because the B cells are gone, now you still have the rest of your immune system, the T cells, the neutrophils, the macrophages working for you. It's not like your immune system is extremely depleted, but some people could get more upper respiratory tract infections, urinary tract infections, superficial skin infections, herpetic virus infections such as shingles or oral or genital herpes. And there's one very serious infection which has occurred only once in a patient taking only Ocrevus, which is PML, progressive multifocal leukoencephalopathy, and we'll talk about that briefly as well. Now, if you look at the actual clinical trials, this is OPERA-1 and OPERA-2, the two trials done in relapsing MS. It looks pretty good. There's certainly infusion reactions with Ocrevus, but the overall infection rate isn't really much higher than with beta interferon. And so it's relatively safe. Now, this is a little bit misleading for the following reason. It turns out that B cells, if they last for a long time, can sometimes turn into plasma cells, which are larger cells that lack the CD20 receptor. Because of that, they're immune to Ocrevus and Rituxan. And so as a result, you still have good levels of antibodies, and the immune system is not that weak. But if you take these medications regularly, indefinitely, over long periods of time, potentially the immunoglobulin levels can go down and make you more susceptible to infections. Now, this is much more well known with rituximab than with ocrelizumab, but certainly it's a potential issue with both medications, and it's going to become more of an issue as more people are exposed to this drug for longer periods of time. Now, in the clinical trials, they did show an increased rate of shingles compared to beta interferon, but again, not a real big increased risk of infections overall, at least over a short period of time. These trials are only 2 years long. Now, what about PML? So for those who don't know, PML, or progressive multifocal leukoencephalopathy, is a rare infection of the brain caused by the virus, the JC virus. The JC virus is everywhere. We could all be infected with it, but it doesn't really matter because our immune system just shuts it down. However, in rare cases, if the immune system is weakened, the virus can become activated and actually infect the brain and cause these contiguous lesions that you see on the MRI to your right-hand side. Luckily, this is extremely rare, and there's actually been only one case with Ocrevus, and I'll go ahead and post up a link to a video where I discuss this. And as you can see in this chart, the risk is much, much higher with natalizumab or Tysabri, and much more common even with some of the oral medications such as Gilenya or dimethyl fumarate. In people with rheumatoid arthritis taking Rituxan, the risk of PML was reported to be about 1 in 30,000, and many of those people were actually taking other immune suppressing medications at the same time. So I definitely think this is a potential risk of this class of medications, although likely extremely rare. Now, what about breast cancer? So when we looked at the data from all of the randomized trials for Ocrevus, it turns out that breast cancer actually developed in 6 out of 781 women taking the medication versus none on Rebif and placebo. Although this seems alarming, it turns out that this rate of breast cancer is actually not that much different than what would be expected by random chance. The idea is that any kind of immunosuppressant can weaken the immune system and prevent your natural surveillance of cancer cells. So it's not exactly known whether this was just a coincidental result or if Ocrevus really could increase the risk of breast cancer. Regardless, on the product label, it says an increased risk of malignancy or cancer, including breast cancer, may exist with Ocrevus. Nothing other than standard mammogram or self-breast exam screening is recommended at this time. What about pregnancy and breastfeeding? Well, generally, this medication is not recommended during pregnancy. In animal studies, it's potentially toxic to the kidneys, the bone marrow, and even the testicles. And in humans taking similar drugs, anti-CD20 drugs, there have been reports of infants born healthy without birth defects, but with a slightly weakened immune system with low B cells. And this can be a potentially serious problem because the infant's immune system is already a little bit weak because it hasn't started making its own antibodies yet. Ocrevus is excreted in the breast milk, but only in very low amounts. But many people would shy away from recommending this in breastfeeding women. It turns out that the protein that Ocrevus isn't really absorbed well by the gastrointestinal tract, so potentially it's not that dangerous in breastfeeding, but is not very well studied. According to the product label, you should not get pregnant within 6 months of taking Ocrevus, although I have to say that's extremely conservative, and we believe these types of medications do not cross the placenta until later on, so that's extremely conservative, and of course you would have to talk to your provider about that particular issue. So if you have any questions, please post in the comments below. If you like the video, please go ahead and click like. And if you have any suggestions for future videos, please post in the comments below.